The Health Ministry announced Thursday that the third wave produced by the highly infectious Omicron strain has spread to practically all corners of the country. Vaccination has led to fewer hospitalizations and fatalities despite the spike. The Health Ministry reported an increase in COVID-19 cases in India, with the weekly positive rate reaching around 16%. The pandemic condition reveals the third surge has reached practically every state. Clearly, the deaths are low. Vaccination has protected. The mortality is low. However, a positive of 16% is fairly high. Some states, Goa, have 50% positivity. The virus is spreading swiftly. Antibiotics must be used. So says Dr. V.K. Paul of India's COVID-19 task force. This compares to 335 districts for the week ending January 12. The ministry stated that 6 states remain of concern due to an increase in the weekly positivity rate from the week ending January 13 to the week ending January 20. Maharashtra, 20.35%, Karnataka, 6.78%, Tamil Nadu, 10.70%, Kerala, 12.28%, Delhi, 21.70%, and Uttar Pradesh, 30.53%, 3.32% versus 6.33%. We are in constant contact with these states and are monitoring the situation. We dispatched central teams to these states, who went to different areas. The state health departments have been briefed, Bhushan said. He said that despite the rise in instances, there have been fewer hospitalizations and deaths due to high immunization rates. On April 30, 3.86 new cases were reported daily, and roughly 3,000 deaths occurred. From April 1 to 30, only 2% of the country was vaccinated. 3.17 lakh new cases and 380 deaths on January 20. Currently, 72% are fully immunized. This comparison reveals two things. First, the number of deaths per active case is much lower than the second surge. Second, vaccination has an influence. La malady affects completely immunized people. Those who haven't been vaccinated should get it, Bhushan said. Bhushan further stated that the current wave has had milder effects. Around 99% of adults have a fever, cough, and throat irritation. By the 5th day, the symptoms normally subside. Muscle weakness and fatigue, these are the symptoms we are seeing in Delhi and we believe the entire country, as well. Fever and upper respiratory infection are prevalent in children aged 11 to 18 years, suggesting the infection does not harm the lungs. COVID-19 pneumonia cases are also rare, he stated. Bhushan cited the situation in Delhi, where hospitalizations maintained between 1,600 and 2,600 between January 9 and 19, despite over 75,000 active cases. On the graph comparing active cases, daily cases, and hospitalizations in Delhi, he added, it is a straight line at the bottom.